Welcome back to UC Davis Live. I'm Satirius Johnson. The pandemic has taken a toll on everyone's emotional well-being. It's had some of its most serious effects on people who were living with mental illness or substance abuse issues before the pandemic. Today, I'll be speaking with two mental health experts about how the pandemic has affected their adult and younger patients this past year and what we can do as family members, communities, and society to help with these problems. Lauren Schurr is Director of Emergency Psychiatric Services at UC Davis Medical Center. He treats patients suffering from medical and surgical illnesses in inpatient and outpatient settings and leads the emergency psychiatry team. His interests are in the integration of mental health into the primary care setting and using population health models to improve screening and collaborative treatment approaches. And Paula Waddell is a child and adolescent psychiatrist who provides psychiatric care for children and young adults. She's the Associate Program Director for the Child and Adolescent Psychiatry Fellowship and the Medical Director for the UC Davis Early Psychosis Programs. Her interests include preventive care, mental health policy, and education. Thank you to you both for coming on today.
Thank you for having us.
So before we get started, I just wanted to remind viewers that this is a free webcast. You can watch it live and watch it after the live broadcast on the UC Davis Facebook, Twitter, and YouTube channels. We're aware of others posting links saying that you have to pay to watch this video. Please do not click on those links. This is a free webcast. And we are taking audience questions as usual. So if you're watching us live, just leave them in the comments section and we'll work in as many as we can. So Dr. Schurr, let me start with you. What have you been seeing in your ER patients during the pandemic?
Yeah, first, I just wanted to thank you for this opportunity, Sartorius, and to be here with Dr. Waddell. It's been quite a year, right? As a person, as a provider, and so mental health, conditions have gotten worse in many ways, and I know that this is an opportunity to talk about that. I do part of my work is in the emergency department, and so we, at the beginning of the pandemic, saw a number of patients, particularly vulnerable populations, so persons of color, essential workers, folks who had job insecurity, younger adults who lost their jobs. They had more exacerbations of mental illness. So one of the things we know is that pre-existing mental illness was a risk factor for worsening depression, anxiety, trauma-related disorders. And so we saw more patients come into the hospital with suicidal depression or with post-traumatic stress disorder that was exacerbated. Or when you look at other severe mental illnesses like bipolar disorder or schizophrenia, patients were having a difficult time getting their medications, or homeless shelters were closing, services that were normally available were not. And so it really impacted the emergency department, and our patients use the emergency department as a last resort. So it's been quite a year in that respect to support our patients, particularly the most vulnerable.
And I mean, the pandemic is just making that all the venues of support that much more difficult, right? Because you can't see people in person as easily. And I guess that's one factor. And then the other factor is that there are all these extra stressors happening between, the threat of the physical virus and all the other social implications that go along with that.
Absolutely. In fact, I have so much compassion for our patients, but also as the health systems were adapting, right? Because back then we were figuring out how much PPE, personal protective equipment to have to protect our staff. We were trying to isolate patients in emergency departments, which are very busy, lights always on places. And then also we were working, we were still developing, testing. And, that was a big part of the pandemic. So keeping patients safe while they are in a mental health crisis is difficult in a non-pandemic situation. And then having a pandemic on top of that made it even worse. And so it's a great question.
So what impacts have there been on your psychiatric inpatients and outpatients?
Well, I would say that, we have still provided high quality care to our patients who need it. But one of the things that we saw was lengths of stay in the emergency departments went up, right? So patients, we have a shortage of mental health beds. There was a pause in many of the services that were happening in the community. So we ended up having to keep patients in the emergency department or even in psychiatric hospitals longer than we otherwise would have, because our normal outflow for discharging was difficult. Plus, the patients were sicker and were suffering more because our visitor policies had to change. It's from a safety perspective, we couldn't have, we know that from a mental health perspective, having family members close by and supporting you during a mental health crisis, during any medical crisis, is critical. And so a lot of those things changed too. So I would say it really increased the severity of illness and the lengths of stay that people were in crisis, especially those early months.
And then on top of that, I mean, in addition to the people you were seeing before the pandemic, who you were continuing to see, were you also just seeing just more people become susceptible to issues that maybe before the pandemic, they weren't quite as susceptible to?
It's interesting. We saw an initial, that's a good question. And I think there's still some questions about that when you look at it from a data perspective, but we did see initial higher numbers. But one of the sad parts is that there were a lot of people who were suffering that I think were choosing to stay home out of safety concerns too. So it was, in some ways, less people might have been coming in when, especially around when things shut down here in California. And so that's a good question that we're still analyzing.
Right. Dr. Waddell, how has the mental health of teenagers and younger people been at risk during the pandemic? And what issues are you seeing in your younger patients?
Yeah, thank you for having me, Satirius. And, it's so interesting with young people. There's no single response. It's been very different. Some have really struggled. They've struggled with the isolation, with lack of motivation to engage in distance learning, with just the general stress that we all feel. But there are some kids who have really thrived. They've responded to the pandemic differently. They suddenly enjoy having more time at home. They've enjoyed the flexibility that distance learning has given them. They've enjoyed the slower pace. Suddenly, academic demands have not been quite as high. So it's been a very interesting mix to see how young people respond differently. I would say the response in parents is probably more consistent than amongst the kids.
So in the kids who have responded maybe negatively to it, what kind of issues are you seeing?
It's a lot of sort of lack of motivation and isolation, depression related to that isolation, the prolonged time spent inside, and a lot of attention and concentration difficulties. It's much harder for many to engage in distance learning than it is in a classroom setting. They really miss that.
A lot of it has to do with maybe kind of just discipline of like staying focused on, what's at hand, as opposed to, I mean, there's so many things that you can, as a, student working from home, even as an adult working from home, being distracted, right? So that must place a lot of pressure on kids who aren't used to that.
Yeah, I think that's true. We've suddenly handed Chromebooks to a bunch of children who do not have the same type of ability to regulate themselves. And I think, to your point, many adults struggle with this too, right? We're constantly being pinged by either social media or our phones. There's a lot of things competing for our attention. And now you've handed a child a Chromebook, and it's a tall order to ask them to not open YouTube and not open anything else and just pay attention to that Zoom.
So what advice do you have for families who feel overwhelmed and find it challenging to carve out dedicated time to check in with each other?
Yeah, I think that's such an important question. I spend a lot of time talking to families about how to support each other and how to cope with the stress. I think the very first thing that parents can do is acknowledge what's happening. It's really important to acknowledge that there's a stressful global event occurring, and trying to pretend that it's not happening is just not going to be effective. Kids are quite perceptive and they pick up on the stress in their households. So acknowledging it in an age-appropriate way, right, is important. And then modeling for your family members how you talk about this. I'm stressed about this, and these are the things I'm doing to help myself cope and to help myself feel better. How about you? How are you doing today?
Right. Again, we are taking audience questions. So if you're watching us live, just leave them in the comments section and we'll work in as many as we can. So to your point, Dr. Waddell, I mean, is there a certain time of day that people can just make it kind of like a habit or a ritual to check in with your kids, or if you're a kid, to maybe check in with your parent to be like, hey, how you doing? Maybe, before bedtime or, after dinner or something. Just, is that maybe a technique to kind of try to, keep in touch with each other?
I think that's a great start. Building that into the day is a really nice beginning. And that's one of the things we've been talking with families about. Make a list of the things that help you feel good and make sure you schedule them. So reaching out to family members, having a check-in time, talking, put that in your day too. That's an important part.
Mm-hmm. Okay. Now, there is a difference between poor mental health and mental illness. Dr. Schurr, how have people with those differing conditions been affected differently by the pandemic?
Yeah, that's such an important question, right? Because there's mental distress and then there's mental illness. And there have been some very well done studies published by the Center for Disease Control and some other organizations looking at population health data around mental health. And if you look, so they've been comparing, if you compare sort of pandemic era numbers of mental distress and mental illness compared to sort of pre-pandemic levels in 2019, for example, about 11%, 1 in 10 people in this country would have significant symptoms of depression or anxiety at any given time. It's actually higher in certain populations, but if you look nationally, during the pandemic, it's been about 41% of the United States population is experiencing significant symptoms of depression and anxiety. And it's important to mention that, the major depressive disorder, anxiety disorders, trauma-related disorders, these are chronic illnesses, just like diabetes, asthma, cardiac conditions that are also chronic diseases. And so we have seen significant increases in numbers of both mental distress as well as exacerbations of existing mental illness.
Right. Dr. Waddell, any comments?
I'd agree with that. I would add that I think mental wellness occurs on a continuum, and it's not a very clear line between when mental distress becomes something more serious. That is really kind of a fluid line. And I think I often will draw a comparison to another chronic illness, asthma. If the air filled tomorrow with smoke, many people would have breathing problems. Those with asthma would have even more, but everyone would. And so when we add a very significant stressor, everyone's going to feel it. Everyone's going to move along the curve. And some people are actually going to move into the category where they have what we would diagnose as a significant disorder. And those with the disorder are typically going to experience worsening symptoms.
Okay. We do have a viewer question. Simone, who's watching on Facebook, asks, have either of you noticed an uptick in PTSD symptoms in children due to the pandemic?
So I think when it comes to trauma in children, children have a very wide variety of responses to that trauma. And how they perceive what's happening is highly variable. I don't know that I can't speak to a very specific increase in, say, PTSD-like symptoms amongst children who don't previously have a diagnosis of PTSD. I will say that those who do have PTSD, I think, have experienced some increase.
I mean, there could be cases where maybe a child had PTSD but was undiagnosed or unrecognized in some way, and then this extra stress pushed them over the edge, maybe.
Yeah, I think that happens as well. And I think the other sort of silver lining of the pandemic has been the increase in telehealth-based services. And that has really increased our ability to engage with some of our families. It's so much easier for them to log in. All the kids have Chromebooks because they were given them by the district. And they know exactly how to use Zoom. They can log in. I'm seeing some of my patients far more often than I ever could before the pandemic.
Oh. Dr. Schurr, I know you deal mostly with adults. Have you noticed an uptick in PTSD symptoms in people?
I've looked at the data around depression and anxiety disorders, but I have in the hospital, I have seen, one of the things we do know is that having a medical illness can be a trauma associated with a trauma-related disorder, and post-traumatic stress disorder, as Dr. Riddell brought up, is a trauma-related disorder. And so sometimes losing a loved one in a way that is sudden, right, can exacerbate a trauma-related disorder. So the answer is yes. I have seen more trauma-related disorders, PTSD, also something called adjustment disorders, or something called acute stress disorder, just to use some diagnostic terms here. But we have seen that. And when you look at how many deaths there have been in the United States and across the world, there is a lot of loss happening, and loss and grief tend to be a precipitating factor that can worsen your mental health, right, and actually exacerbate a mental health condition. So I have seen it in the emergency department, and I've also seen it in our practice within the primary care network as well.
Right. Elisa, who's watching on YouTube, is asking, what are the warning signs that a young child is having a mental health issue, especially for those who are not overly verbal? Dr. Waddell?
Yeah, I think this is a tough thing. Many parents have felt pretty concerned about their kids during this time, especially when kids are spending so much time online. It's hard to know exactly what they're doing and what they're engaging in. It's hard to monitor that. I think in general, we look for a change in how somebody is functioning in their major roles. And so what does that look like? A sudden change in grades for kids. So suddenly not engaging with teachers in a child who used to engage, not having interest in doing activities that they used to be pretty excited about. Looking for some of those behavioral changes, like staying in their room all the time, not having any interest in coming out. Although it's worth noting that sometimes these things increase in an age-appropriate way, sometimes during adolescence. So it can be challenging for a parent to know exactly what's going on.
Right. It's always a challenge with kids, and this just doesn't make it any easier.
Exactly.
So what are some of your top tips for maintaining mental health for both adults and kids? Why don't we start with you, Dr. Waddell?
Sure. Yeah, I think for many of our kids who have been working with us for a while, who have a diagnosis, have been working with a therapist, one of the things we do early on is develop a list of coping skills. And for kids who have typically done quite well, they've actually never developed one of those lists because they've never needed to. And one of the striking things I saw when the pandemic began was we needed to teach a whole subset of the population how to do this. They didn't have practice in it. They didn't have that skill set. So sitting down and, like I mentioned before, developing a list, very simple, of small things that you enjoy, that a child enjoys, and finding ways to incorporate that proactively in the day, not waiting until something's not going well, but really thinking about it ahead of time and scheduling in those things that are going to decrease stress, whether it's enjoying a favorite healthy snack, going outside for a walk, taking a minute to enjoy whatever flowers are blooming. They can be small things, but you do need to take some action to schedule them in.
That's really important. Dr. Schurr, what are some of your tips for maintaining mental health?
Well, first, I'm definitely taking Dr. Waddell's advice. I like that I have a lot of child psychiatrists as friends as well. I have 3 children. So thank you, Dr. Waddell. I think when you think about well-being, we talk a lot about the same things that are good for the heart are also good for the brain, right? Sleep, regular sleep, getting 8 hours of sleep a night is well studied to help with mental well-being, being able to think clearly and function well in school, function well at your job. And also we've seen it, we haven't talked about substance use disorders as much yet today, but we've seen a big uptick in alcohol use and other substances, right? Whether, and there's a long list of substances that people use. And so alcohol use has gone up significantly. If women have more than 1 drink a day, or men have more than 2 drinks a day, it can really impair your sleep. And also alcohol is a depressant, and it can actually exacerbate Depression, if that is something that a person is suffering from. It can also exacerbate an anxiety disorder. And so limiting alcohol, to a healthy number of drinks, right? Just really not very many. We recommend that women not have more than 1 drink per day, and men more than 2 drinks a day, but really just mostly on the weekends, right? So not drinking every day either is really important. So sleep, we talked about. Exercise, that's critical. Taking walks, being with loved ones, being connected socially to family and friends. That's been one of the hardest things about the pandemic, is that it's kept us apart from our loved ones. And so thinking about ways to connect with others, if you have to do it virtually, that's something we've talked about a lot during the pandemic. Now that more people are vaccinated, they're connecting more in person in ways that are safe.
Right. And a lot of these things, I mean, people have to do for themselves, but sometimes they can't do things like that for themselves, like, substance abuse, alcohol abuse. So that it might fall onto like a family member or a friend, and it's a very difficult maybe topic to bring up and to approach. So how do people end up with, I guess you're in the emergency department mostly, and so you probably see things when they get to a very bad phase. How can, somebody, say, like a family member or a friend who notices symptoms, how can they reach out to somebody to kind of help them see that they need to make a change?
Well, I think that, Dr. Waddell was talking before about warning signs, right? And one of the things that we see when someone is getting depressed is they start to isolate, right? So they start to not connect, they start to not function as well at work. And when you see that someone is isolating themselves and not acting the way they did before when they were healthier, that's, you want to encourage that person or someone who's close to them to get them help, right? There's all sorts of things around, suicide hotlines, where if people who are having thoughts about hurting themselves, that is a common symptom of depression, right? People have thoughts of hurting themselves, but when someone starts to talk about it, you want that person to get to a mental health professional, to get to their primary care doctor so they can have an evaluation. One of the things I feel strong, as much as I enjoy working in the emergency department with our team to help people who are in crisis, I'm a big believer that we need to expand the mental health system into the primary care system. So just as it's important when I go to the doctor to have my blood pressure taken, we also need to ask screening questions for depression, screening questions for anxiety disorders, screening questions for trauma related disorders. And so we have to identify it within our own communities, but also within the primary care setting where the vast majority of patients go.
Right. And on the point of isolation, I mean, with the pandemic forcing us to be more physically isolated, it's even more important to stay socially connected with our friends and our family, to just make sure everyone's doing okay, and to notice if there's a difference in behavior or any kind of symptoms like that. Laura, who's watching on Facebook, asks, do school districts have a responsibility to provide mental health services related to distance learning?
It's an interesting question about what we ask our school districts to cover in terms of mental wellness. I don't really have a great answer for the question, other than to say I think this branch of school-based services is really important, and it's something that we talk about a lot in mental health. How do we meet kids where they are and provide services where they are, which is the school setting? There've been a lot of efforts towards this, and it's something our department has been interested in as well, in expanding those types of efforts, but we have a long way to go.
Yeah. Catherine from YouTube asks, law enforcement are forced to respond to mental health calls from more often during the pandemic. Is there a desire from the mental health community to partner with law enforcement in community response?
Yeah, maybe I'll start with that one. That's a great question, and appreciate that being asked in this setting, because I agree that there's a real important need to have the right professionals showing up during a mental health crisis. Law enforcement officers have some training around handling a mental health crisis, but they're not the ideal person to work with a person who is having an exacerbation of schizophrenia or potentially a suicidal depression. You really need a trained mental health professional to work in sort of a mobile crisis team. So there are efforts happening in Sacramento County and in the city. We have a Mayor Steinberg is extremely supportive of mental health initiatives. There's more policy work to expand mobile crisis services. But we need more of that, and we need more funding for that too. So, so training of law enforcement, and also having more first responders that are mental health trained first responders. So absolutely.
Yeah, I would agree. You know, Dr. Schurr, I think there has been progress in this area. I wish it were moving faster too. Crisis intervention teams are pretty much pretty effective, and we need more funding and expansion of those services, I think.
Okay, Elisa from Facebook is asking, well, she says, depression is most often associated with women and their symptoms. Are depressive symptoms in men different? So I don't know if her supposition is accurate, that depression is most often associated with women and their symptoms, but how do you respond to her question?
Do you want me to start, Dr. Riddell, or you want to go? Why don't you go first?
Sure. I believe the statistics on depression is that it's not so gender specific. I think both genders are affected very significantly by depression. Everybody tends to display depression a little bit differently. Again, there's not a one size fits all. And I can certainly speak for what I spend more time, obviously, on children and on looking at how depression looks different over the age span. And we definitely see that. We see in younger kids a bit more irritability. And so sometimes that is labeled as sort of anger or oppositionality, and that can often actually be depression. I don't know if Dr. Schurr, you wanted to add.
Yeah, thank you, Dr. Riddell. I mean, it's a good question. And so the answer is diagnostically, the symptoms of depression are very similar, right? Like there are really good studies that went into the diagnosis of what we call major depressive disorder. I'll start with a statistic, but 10% of disability worldwide comes from that illness. Major depressive disorder is a chronic disease, and it is a very serious disease, right? And it does, if you look at large population health studies, it's more common in women, but clinically, when you look at the person suffering, the actual symptoms look the same. And if you experience depression, you feel sad. It's not just sad because you got a bad grade on a test, or because someone close to you passed away, or you got bad news. But the sadness of depression is, I feel bad about myself, but I'm actually going to think that, Sartorius, you think bad things about me too. It affects the way we think. It's a terrible type of human suffering, one of the worst types, but it's also a body illness. It affects the way, it affects our sleep. It's classic to, like, if you're in a depressive episode, you wake up at 5 a.m, even though you're tired, you want to go back to sleep. Your appetite is down, you have unexplained weight loss. And it also affects the way we think, right? Those distortions, the way we misinterpret statements of others. We feel worthless, we feel hopeless. So men and women both feel those terrible symptoms during depression. They may have thoughts of hurting themselves as well. So the answer is that the studies show that depression is a little bit more common in women, but it presents similar in terms of the symptoms.
Mm-hmm. There was anxiety surrounding the beginning of the pandemic. Now there's a new anxiety that some people are feeling as schools and businesses open back up. Can you talk a little about coping with this new kind of anxiety? I guess both of you.
Yeah, I think we are again in uncharted territory, and that's really important to keep in mind. So at the beginning of the pandemic, we were coping with the onset, and we continue to find ourselves in a very novel, new experience. So many of the same things I suggested about just coping with the pandemic in general apply here. Really focusing on the things you can control, things you can do, the public health recommendations you can follow, and understanding that there's some level of there's aspects of this that are just outside of one's control. I think staying informed is helpful to a point. Sometimes it becomes a little bit overwhelming to take in a lot of this information. So carefully balancing that and continuing to be really proactive about those coping skills that I was talking about earlier.
Yeah, I couldn't have said that better. I think that I think validating people's anxiety too, right? If you haven't been around, you haven't been going, some people haven't been going to the store for so long, right? They've only been doing essential shopping, maybe at night or in the morning. And so validating it, right? Actually treating your family members, your friends, your patients with compassion around it, right? Because it's understandable that there's anxiety. I mean, I myself I'm going to see a family member who's going to have surgery. I haven't been on a plane in a long time. I'm feeling anxious about that. And I'm self-validating that and talking to my wife about it. So I think pointing out feelings and labeling them is really important in mental health. And we need to practice what we preach as well.
Right. I'd say sometimes I'll be watching a TV show that was shot before the pandemic, where it might be like a crowded street or a crowded restaurant. And I'm just like, I get a little like anxious. I'm like, what are and it's like, so kind of transitioning back to a new normal, eventually, maybe gradually. I mean, it's going to take everyone a little bit of kind of, adjustment.
I fully agree.
So what lessons can we draw from the pandemic? I mean, about making society more healthy and more resilient. I mean, this has been a huge, just change that we've all kind of been forced to go through very quickly. Is there anything that we've learned from it that we can apply going forward, as maybe the pandemic will be in the rearview mirror?
I think there are a number of lessons we're going to take from this period of time, and we're going to continue to learn from it. As we move forward, as we reflect on our experiences, we're going to continue to learn things that we've already learned. There's a lot we can accomplish using technology. Things that we used to think had to be done in person maybe don't always need to be. And we can make better decisions about the things that are truly necessary and beneficial to be done in person, and those things that, for convenience, for flexibility, for parents who need to be flexible for their families. We're going to have a new level, I think, of flexibility that will ultimately be beneficial. I also think telehealth, the expansion of telehealth, has just been so important throughout the pandemic. We have learned very rapidly how to deploy telehealth services in a really big way with excellent impact. And that's something I hope we're able to continue with, because it really improves access and helps make it far more convenient for people to access services. So I think that's going to be really beneficial. And I think collectively, we've all had to deal with a shared stressor. And there's some learning that has come from that, some recognition of the validation and acknowledgement of these feelings, and the skill set that has come with it of managing this very significant stress that will take forward and really help build resilience for everybody.
Yeah, I appreciate the wise words of Dr. Waddell. I couldn't agree more, and just wanted to stress the importance of video visits and telemedicine. It's not the only answer to mental health treatment, especially in outpatient settings, but it works. There's good data to support the treatment of depression, anxiety, PTSD, bipolar disorder, other illnesses, other mental health conditions through telehealth. And so it really does work, especially in rural communities where there are very few psychiatrists. Another big thing I think I would like to mention is that there's some data that mental health stigma is actually going down. Stigma is a big issue to access to care because some, people feel uncomfortable sometimes going to their doctor to talk about feeling sad or depressed or anxious, or to talk about their trauma. But when you think about it, going to the doctor for high blood pressure or diabetes or asthma, which Dr. Waddell brought up before, these are also chronic conditions. But if you have depression and anxiety and trauma, your physical health conditions are also not going to get better. So we need to continue to talk about mental health as conditions, as disorders of the brain, which is what they are, and also disorders of the body that impact our well-being and impact our connections to the ones that we love. And so I think countering stigma, so having more Facebook Live meetings about mental health. So I'm grateful to you for shining a light on this, because it's really important for the whole country and for just populations in general, for people.
Right. And I guess a silver lining of this, of the pandemic forcing us to be able to do Zoom meetings and telehealth, is that maybe people who are still have some stigma over mental health, they might actually feel more comfortable reaching out for help through a telehealth visit or just interacting with a professional that way.
That's true. Actually, there's some really cool data on that, which is that certain people, not everybody, are actually more comfortable talking about certain aspects of their life through a video visit, right? Because in some ways it's too intimate to sit in person in the room. Not for everybody, but there are some people out there, particularly maybe folks who are more comfortable using social media or have grown up with more technology, are more comfortable talking about their mental anguish, their mental suffering. And so we've learned some of that in telesuccess. And so we want to be able to give access to care in different ways, in person, through video visits, be it using technology in a way that's creative and evidence-based.
All right, well, this has been really great. Thank you so much for coming on today and sharing your insights.
Thank you for having us.
Absolutely, thank you.
Lauren Schurr is Director of Emergency Psychiatric Services at UC Davis Medical Center, and Paula Waddell is an Associate Program Director for the Child and Adolescent Psychiatry Fellowship, also Medical Director of the UC Davis Early Psychosis Programs. Until next time, I'm Satirius Johnson, and this is UC Davis Live COVID-19.